It is not designed to be the only source of information about circumcision and in no way takes the place of consultation with a healthcare provider. The video demonstrates the three most common circumcision procedures: Plastibell, Gomco, and Mogan. Due to the highly graphic nature of circumcision surgery, viewer discretion is advised. First, the Plastibell circumcision procedure.
This is a circumcision board, and we have to use it to keep the baby from moving his arms and legs so that he won't interrupt the procedure. They don't like it, and that's why he's crying. And he'll cry through this whole procedure, not because he's in pain, but because he's held down, and he's also going to be cold.
The baby is hungry, which adds to his discomfort. In most cases, infants are not fed prior to the procedure to reduce the risk of vomiting. The baby's penis is cleansed with an antibiotic solution.
Again, this is very cold, and that's probably why he's crying right now, is because it's a cold solution and he doesn't like that sensation.
With a small needle and syringe, a short-term anesthetic is injected into the skin at the base of the penis.
Worst part of it.
Because infants soothe themselves by sucking, a pacifier is often used to calm the babies during the procedure. The area is cleansed with an iodine solution, and sterile drapes are placed over the surgical site.
There we go. This is a Plastibell, and this is what I'll place on the area and cut the foreskin off around it. It'll be tied on. You'll see that later. Right now I have to loosen up all the adhesions that are underneath the foreskin. He's fine. Okay. This is the string that I'll use to tie around the Plastibell. He's crying, but it's not because he's in pain, it's just because he's being held down and cold, because he does have a local block. I'm just continuing to loosen the adhesed skin that's underneath the foreskin so that I can put the Plastibell on. Okay. Now the Plastibell fits underneath the foreskin. And what I'll do is tie off the foreskin with the string. Okay, now the skin is tied off with the string, so all I need to do now is clip off the redundant foreskin and we'll be finished. have to now is clip off this extra plastic device, and we're finished. This plastic bell will stay on there for about 5 to 7 days, and then it will fall off and it'll be a nice even edge for the circumcision. But that plastic bell stays on there, and Mom will keep it tended with Neosporin ointment until it falls off.
After the procedure, antibiotic ointment is applied to the circumcision area. This ointment promotes healing, reduces the chance of infection, and helps keep the diaper from sticking to the penis. The baby is then swaddled in a blanket and returned to his mother for feeding and soothing. The Gomco clamp circumcision procedure. The baby's arms and legs are restrained using straps from a circumcision board.
Okay, hold on. Somebody hand me that bulb syringe, please.
In most cases, infants are not fed prior to the procedure to reduce the risk of vomiting. The base of the penis is cleansed in preparation for the injection of anesthetic.
This is called a dorsal penile block. The nerves come from the base of the penis up to the penis, and we just try to block it at the base.
Yep, you're getting that bulb syringe again.
This is some anesthetic and place it in there. Usually once they realize they can't move, they're pretty calm. Whoa! This is antiseptic. That's pretty common for the baby to pee while you're trying to do it. There he goes again. And he's had something to eat right before he came in, and he's kind of spitting that up. It's not very common. We have to suction them like that.
A sterile drape is placed around the surgical site.
Usually they feel it. No matter how good a block you get, sometimes it's just not good enough. And you just do the best you can. We open up the prepuce, the foreskin, and then we try to break the adhesions gently. And the adhesions go all the way around, except to the very back part of the penis where we don't break that adhesion. That's a normal attachment at the base of the prepuce. And the prepuce is just the tip of the penis here. And he's got a pretty good block today. Most of the time they don't mind telling you about it when you're doing this, but he's doing pretty good. This is a dorsal penile crush. And what we try to do is to crush the foreskin so that when we cut it, there will be no bleeding. And also when we cut it, they usually won't feel that. A lot of times they cry not because they're in pain, but they're very frustrated about being tied down. And they don't like that. Okay, now we've got the dorsal crushed in the slit. And we can kind of maneuver our way to the base of the head. Okay, and this is a little blunt dissecting probe, and what we do is try to break any further adhesions. Usually they don't like this either, and he's doing real good, so I must have gotten a halfway decent block on him. This clamp will pull the foreskin up through like this, and it's just like a bell. And the penis would be in the bell, the foreskin would be around the bell. Put that over the clamp like that. And once you get a nice, good position, you get the clamp in its pivot, and then we clamp it down. And what that does is it pulls the foreskin up against the flat part of the, I guess you call it the guillotine, and then we just cut the skin off. The real nice thing about this is is it puts pressure at the cut site on the penis. So if you can leave it for a couple minutes, the pressure on the cut site will actually cause some coagulation. It will allow it to stop the bleeding. If you do it right and you do it correctly, you should never ever have any bleeding unless there's a bleeding disorder in the baby or there's a blood vessel. So what we do is move the bell in here, grab the foreskin across like that, and then you have to grab it again through here to be able to pull it through. Okay. This is the worst part for them. It's still fairly sensitive. What we try to do, the good thing about the Gomco also is we can exactly measure how much skin we want to take off. Okay. So it gives us a little more control over how much skin we can get off. And we've got the foreskin right at the base of our cut. We raise the clamp up. And this is the part that they don't like, and this is where we put pressure against the foreskin, and it does sting just a little bit. But once they're over that one sting, there's no more pain. And you'll notice he starts quieting down. And while he's sleeping, I'm cutting. And you notice he's not feeling a thing now. The pressure against the cut site is keeping it from bleeding. Now we're going to release the clamp, nice and easy. And we push the clamp through, nice and coagulated. No bleeding, no problems. And I just kind of gently move the skin out from underneath it. And we have a really nice circumcision there. Put a little bit of Vaseline gauze on it. And we are done.
The baby is then diapered, swaddled, and returned to his mother. The Mogan clamp circumcision procedure. The baby's arms and legs are restrained using straps from the circumcision board, and his diaper is removed.
Okey-dokey, he's ready.
The base of the penis is cleansed in preparation for the injection of anesthetic.
And we basically inject a little bit of numbing medicine at the base of the penis where the nerves come in. And this is initially uncomfortable to the infant because it causes a little bit of burning. And the initial stick is, of course, not the most comfortable thing. This is called betadine. It's cleaning medicine. It kills any bacteria in the area. It's cold, and this arouses our patient, but it's not particularly uncomfortable.
A sterile drape is placed around the surgical site.
Well, he's trying to identify the opening of the foreskin and attempt to see the opening of the urethra, which is where the urine comes out. Sometimes this isn't always possible, and first we have to put some clamps on the baby to aid us in opening the orifice. I'm just going to put a little bit of stretch on this skin here. It's not, hopefully not highly sensitized, but anytime the baby feels pressure, it's very likely that the baby will cry. With numbing medicine, you can eliminate the pain sensations except for pressure. And so the baby will still feel uncomfortable at times, but it's more than likely just a pressure sensation. Once again, stretching the opening. And now I'm going to what we call lysis of adhesions, which is taking some skin that has attached the head of the penis to the foreskin, some scar tissue, similar type skin, and remove that, being careful not to put the tip of the scissors into the urethra. And for this we use a tool with a curve on the end so that we can see where we are on the foreskin.
The Mogan is a hinge device with a beveled edge and a clamping lever that holds the mechanism closed.
Now that I feel like I've lysed the adhesions well enough, I'll take one last look, kind of get an idea of the symmetry of the penis to make sure I get a good result. And then we'll apply the Mogan, and this causes some more pressure on the child. We're always careful to assure that the head of the child's penis does not come up into the area that's going to be cut. The tool is shaped so this is unlikely to happen, and we want to make sure we have enough of the foreskin so the child gets a good result. Now we'll close the clamp. Now that the clamp has been firmly applied, we know that the foreskin tissue here no longer has a blood supply to it, so we can take and cut the remainder of the foreskin off. And as you can tell, that the infant has no feeling of this because this would be very painful otherwise. And I believe he's gotten a pretty good block. We'll open the clamp. And we'll use some forceps to pry apart some of the tissue that was clamped together. And this reveals the glands or the head of the patient's penis. And there's minimal bleeding involved, and a pretty good result was obtained. Since we're assured that there's no longer any bleeding, we can apply some petroleum jelly, which is very soothing to the baby, and this procedure's done.
Again, the baby is diapered, swaddled in a blanket, and returned to his mother. For each of the 3 circumcision procedures, the healthcare provider will instruct the parents on the continued care of a newborn circumcised penis. Bleeding and infection are rare, but healthcare providers will routinely alert the caregivers of the potential warning signs.